Hey guys, welcome to Soma Psyche. Today I'm going to be talking about a method that I have been introduced to over, I would say about 6 months ago that has become really central to the way that I understand somatics and something that I use both personally and with my clients on a regular basis. I was first introduced to this by one of my professors at the California Institute of Integral Studies. And he shared this with me because we were having a conversation about the challenges of bottom-up psychotherapy when therapists are not trained in a specific somatic modality, but still really want to be doing their therapy from the bottom-up perspective. And so he shared this with me, and I immediately went and bought the book and also got the audiobook. And so I want to share these with you because they're really approachable. It's not a complicated thing to learn or to do, but it's also very adaptable in terms of our work with our clients because it can be just a short thing that we do in the midst of a larger piece of work in a session. And it can also be a way of doing therapy on the grand scale. And so I've got 2 books here that I want to share with you. The first one is the little manual called Focusing. And the author of this is Eugene Gendlin. And he did a research study out of the University of Chicago. And Focusing came out of that research. What they were looking at is what is the essential ingredient in effective psychotherapy? What are what they labeled master clinicians doing in their therapeutic work that seems to make such a difference, regardless of what their training was or what particular modalities and interventions they were using? So when they analyzed all of the data, what emerged from that is that these master clinicians were doing something in particular that Gendlin then called focusing. And what the essential ingredient really was the ability to be very present in the actual moment, right? So this present moment with what's happening with your client, with specific focus on listening and tuning in to what is happening in the core of the body, and letting stories slowly emerge from that place. This research was done several decades ago at this point, and Focusing has been around since about the 80s. And you can see lots of YouTube videos from back then of people talking about it and teaching it, and they're still incredibly valuable, and I encourage you to do that. But what I think is interesting is with the addition of all of the neuroscience and all of the new research that's coming out of really understanding why bottom-up therapy is so effective, we can pair that information with this, and we get a really rich understanding of what we're doing in our therapeutic practice and why it is so effective. So I'll bring in the concept that comes from polyvagal theory, which is story follows state. And here at Beyond Healing, we like to continue that and say story follows state, follows story, follows state, follows story, and you could continue ad infinitum. The reason for that is because we believe in really tuning into the reciprocal process that's always going on for our clients and for ourselves between the sensations in our body and the stories that we create about them. And a lot of the times, our clients are very disconnected in that cycle. And what begins to happen, especially because of our culture and our fixation on cognitive process and rationality, is that we begin to impose story on the state of our body rather than allowing story to gently emerge and really honor what we're experiencing. And when we're too quick to impose story, we end up really disconnected from the truth that our body holds. So to me, Focusing is a way of beginning to heal that disconnect and beginning to honor all of the information that our body holds and slowly letting story emerge from that place very gently without jumping to conclusions that make rational sense to us. So that is my introduction of why I think Focusing is worthwhile. And I absolutely want to give credit to Eugene Gendlin and his research team and all of the people that have come before us that have put this together. And I want to encourage you guys to get their resources. So Focusing, this is just a little book, and it's super fast and easy to read. This is client friendly. Okay, I give this book to clients. You can also get the Audible book, which is even shorter and more condensed, and have your clients listen to that. I encourage you guys to listen to it as well. If you want an even more thorough explanation of how to use this in psychotherapy, Gendlin did write this book, which is Focusing Oriented Psychotherapy, a manual of the experiential method. And this really deepens the work of focusing and looks at the nuances of how to apply this as a psychotherapist in the clinical process. So I'm not going to go into the details of this today because, as you can see, this is big and definitely worth your time. But today what I want to do is introduce you to the basics of focusing and try to teach you first from a left brain cognitive perspective. I'm going to give you the information. In the next video in this playlist, you're going to watch me actually go through a focusing process myself, okay, without the articulation of the instructions, but just listening to me think through and feel through and let story emerge from my own body around a particular issue. So you're going to hear me talk about it in this video. You're going to watch me do it in the next video. In the next video after that in the playlist, you're going to hear me give instructions that you can use or you can give to clients that is simply the guide for how to have a focusing session. So rather than the extra explanations, it's just the guide for having an actual session, because we know that's going to be useful to you guys as well. So let's get to it. So the very first piece of focusing, because it does happen in a series of steps, is what he calls clearing the space. And like so many other somatic-oriented modalities, there's honor paid to our body's need to just have a moment to settle where we are, to remember that I am in a space having a experience here in this moment, and I might just need to take a breath. I might need to look around and make sure that I feel safe and comfortable where I am. So whatever clearing the space means, go ahead and do that as your first step. With your clients, I recommend that you just let them kind of settle in. Sometimes I'll offer a pillow or a blanket. They can lay down, they can get comfortable, they can, cross their legs and take off their shoes, whatever is going to help their body really enter in. Because we're going to go into the core of ourselves, and that is a new and unfamiliar place sometimes. And so we want to make sure that we're being as supportive as possible. So step number one is clearing the space. After that, we're going to begin to review in our mind what a good focal point will be for our focusing session. This can be literally anything, which is part of why focusing is so adaptable to whatever we're working on. So it's great as a daily meditation practice. For instance, you can say, what is the most pressing for me today? What am I feeling about and thinking about the most? And whatever the answer is that emerges, that's what you're going to focus on for the session. Or you can have awareness that you need to work on something. There's something that has been bothering you, producing a lot of anxiety, producing a lot of distress, and you might choose to have a focusing session already knowing what you want to focus on. Any of that will do. In therapy, often the topic for focusing will emerge in conversation, and I'll ask the client, would you like to pause and focus on that together if they're familiar with what focusing is? So however you choose to identify what you're going to focus on, the first step is to get clear with, this is what I'm focusing on today. And after we've done that, we're going to move to the step where we're getting the felt sense of that thing. Gendlin's description of this I find really useful. He talks about this idea that whatever issue we're focusing on, we have the layer of awareness that I'm already in conscious awareness of. So as an example of that, it's a rainy day today. How do I feel about the fact that it's a rainy day? Good. I like the rain. I'm already aware of that. Really nothing interesting there, right? So the first layer of focusing is just identifying like, okay, here's what I already know I feel. Layer one, check, okay? But then we're going to sink into a deeper place. And the felt sense asks us to go into the core of ourselves and really feel what is underneath that already known layer. And Gendlin refers to this as a murky zone. Some people that I work with prefer to call it the misty or cloudy zone because murky feels ominous to them. So finding a word that works for you and your clients. But the point is, this is a zone where when we touch that place in ourselves, the first thing that we sense is a question mark. We don't know what's there. We can feel that there's something there. There's sensation. Something's going on. But what it is, what meaning to make of it, is not readily apparent to us. So that is where we're going to sink in and begin to focus. And the first step is, rather than going deeply inside of it, we're just identifying what's on the surface. Okay, so we're getting that top layer, and then we're going to get ready to move in even deeper than that. So as we sink in and go deeper, the instruction is to feel along the core of your body. Okay, and the definition of core in this sense is anything along your spine, meaning from your jaw, because our body likes to hold tension and all kinds of sensation and feeling up here in our jaw. So from our jaw and the base of our skull, all the way down to the base of our spine, in our pelvis or pelvic bowl, right? Even deep into our hips, we hold a lot there. So we're going to go into the core of ourselves, feeling all along our spine, including those organs that sit right along our spine, and sense deeply what occurs there when we hold our focus on whatever issue is that we're working on. Okay. And remember, I'm going to give demonstration of this to really make it come alive for you guys. Once we have done that, we're going to just sit there for a moment. And if we're practicing with a client or a partner, we can articulate, give language just a little bit to what we're sensing. And that kind of helps us to hold our awareness there. The next main step after that is what we call finding a handle. And a handle is a word or a phrase that attempts to articulate the main meaning of that felt sense in our body. And right here is the first time where we're asking our story-making self, our self-narrative self, to come in and give some articulation and language to what we're sensing. And that moment is a very tender and sensitive moment, because we can be tempted to rush into a logical story and impose a story on our body in that moment. Let's say that the sensation is, I'm feeling tension right here. Well, maybe that means I must be anxious, right? And the way of focusing and letting a story emerge and a handle emerge would say, well, maybe not. Maybe it means something else today. So rather than assuming that that sensation means anxiety just because that's a logical answer, I'm going to pause and I'm going to see if I can invite that sensation to offer up a word or a phrase that is a good fit for what that means. So often right here, we just sit in silence for a moment, right? And we instruct our client to wait for a word or a phrase to emerge. A lot of times my clients are nervous that nothing's going to happen. And I have yet to have a session where, if we're patient and after a few moments, sometimes a full minute, eventually a word or a phrase emerges. The nice thing about focusing is that it has nothing to do with getting the right word or phrase, especially right away. What we do when we find that first handle or phrase is immediately offer it back to the sensation to check and see if it's a good fit. So the language that we use there is, okay, let's say the phrase was, I'm anxious. I would say to the client, so now I want you to take that phrase, I'm anxious, and bring it back to that sensation in your chest. And we're just going to check, is that right? Does your body feel a yes to that or a no to that? Or is it more like a kind of, but not quite? Oftentimes that ends up being the answer. It's something like anxiety, but we're not quite on it just yet. So then we ask that sensation once again to clarify, right? So if it's something like anxiety, what word or phrase is going to be an even closer fit? And once again, we wait for that to emerge. And when we find a handle that feels like a true yes, we bring it back to that sensation and we just sit with it. We don't move into a long, articulated story about what all of that means, right? That can be very tempting to do. Instead, we bring it back to the sensation in our body and just sit with the pairing of the sensation and that accurate handle or label for it. And we invite our body to do what it will with that pairing. And oftentimes the sensation will start to shift and move. In that space, clients, humans, us, will often get emotions coming up, images, memories. What is occurring in there is that we have given true articulation to something that is held in our nervous system and wired together synaptically something that was not previously wired together. And our body and our mind is very adept at working in that story state cycle in order to integrate our experience. So when we get an accurate or close to accurate articulation of something that we're feeling, that cycle starts up and we're integrating. We're making meaning of our experience with our body on board, and healing can happen in the midst of that process. But the important thing with focusing is that we're always staying tuned in to honoring the body. It is about letting the body bubble up the truth of what's going on rather than imposing a story on it. And we might go through that cycle of finding a handle, offering it back to the body, right? Does that fit? Adjust if needed. Once it fits, we let it shift, and maybe now we have a new sensation. And we go through that process again, right? Let's articulate as accurately as we can and close to the body as we can. What does that mean? And then we offer it again and we let it shift again. So you can see this can go on for a very long time. And sometimes it does, right? So you can do this for 5 minutes as a morning meditation just to check in with yourself. How am I feeling about my day, right? And you can get all kinds of information to help you prepare for your day and kind of set the tone for your body and your mind to be working together in an integrated way. Or it can even go as far as deep trauma processing. And this is what I mean by it being very, very flexible in its application. So those are the basic steps. And the way that I do it, because I've sat with the instructions a lot, is I don't do exactly what it says here, but I want you guys to have this as a reference. Gendlin put a lot of work into giving very clear instructions and articulation. So I'm going to give a video that's the exact language here. And next, you're going to watch me do a demonstration of me doing this on my own body so you can see the organic process and how story and state work together to provide an integrated experience.